to stillness.
Mindfulness meditation and journaling apps, mood trackers and digital self-therapy. Research shows Australians are the highest users of mental health apps and use is up 75% since the start of the pandemic.
There was a recent survey where a third of psychologists have closed their books. They just aren't accepting any new clients at the moment. So people might be downloading apps just because there is no face-to-face, in-person option.
The Victorian government recently announced $13.3 million invested in counselling services across the state to meet the increased demand. But the shortage isn't the only reason people might turn to self-therapy apps. The stigma of seeing a therapist, convenience, and the high cost of traditional therapy all play a part. But Dr. Marshall says only a small number of these apps are developed empirically.
Have they been developed from an evidence-based framework? Have they been developed with the input of mental health professionals?
Izzy Burns has experienced traditional therapy and uses apps to manage immediate stresses in her life.
Until you can find a psych or until you can get affordable help, if you can't access it, it'll just kind of help you cope until you can find someone, I think.
Trends noted by Dr. Marshall's research include apps seeing greater benefits for anxiety sufferers than those with depression, users who are already in therapy or on medication, and those who have experienced their mental health condition for less than 5 years.
It's more about the individual and their own characteristics and how that sort of, that interplay, if you like, with the app. So we found evidence that all the apps we tried were effective for some people and not others.
Ellie Mitchell for RMIT Newsline.